patients can officially now apply for a medical marijuana card in the state of Utah.
Yeah, that law went into effect today, and news specialist Garna Mejia has a breakdown of what people need to know and how the process works. Garna.
Refer to it.
Yeah, good afternoon. That law goes into effect today, and that website should be live right now. It's where you can go to find information about doctors, about how to apply for a medical marijuana card, and where your local dispensary will be.
It's been in the law. The program has to get up and running by today. And so the Department of Health, the Department of Agriculture, everyone's been working up till today.
Starting today, you can visit medicalcannabis.utah.gov to apply for a state-issued medical cannabis card. As Connor Boyack, president of the Libertas Institute, one of the major proponents of medical marijuana in the state, explains, patients are required to meet in person with a qualified medical provider.
The physician can say, check, Connor is a patient, I see he signed up, and I want to recommend him.
Important points to keep in mind include 1, to get a card, you must have a Utah ID. 2, have a qualifying condition. 3, your medical provider must sign off on your application online and be registered with the Department of Health, although they can register after your in-person visit. 4, pay for the $15 application fee online.
The Department of Health will then issue to the patient a medical cannabis card or certificate, and that's what allows them to go into the dispensaries that in the weeks and months ahead are going to start to open and be able to purchase their medicine here in Utah.
Once issued, cards are valid for 30 days and need to be renewed by medical providers. After that, they're renewed every 6 months. Utah's first dispensary, Dragonfly Wellness, will open in Salt Lake City tomorrow.
It's going to be a slower rollout. It's not like all the dispensaries are required to open today.
In total, 14 dispensaries will open across the state. You can find their locations on the website.
What's very critical is that we've wanted to make sure that patients, whether you're up in Logan or down in St. George, are going to be able to get access. So not only are there going to be 14 throughout the state, but over time, throughout this year, several of these dispensaries are actually going to start to deliver.
Now, this is what the website is going to look like, and it's up live right now as we were telling you. Experts did tell us they did see a couple of glitches with it earlier today. Those were fixed, but it's something that they say they expect is going to happen as this new transition process takes place. In the meantime, patients will be able to continue using those doctor letters that they've been having through the end of the year.